This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. Hi, I'm Mark Alyn, and along with the insane Daryl Wayne, we're going to spend the next 2 hours talking about a wide variety of health issues that touch each and every one of us. During hour 2, we're going to be talking about sleep and the importance of getting 8 hours, they say, of sleep a night. We'll also be talking about snoring and sleep apnea. We'll talk with health reporter Maria Dorfner. She was on the show a couple of years ago. Her last gig was as a producer of Good Morning America. She's been a good friend for over 20 years, and we'll be talking to her about her take on health in the United States. And during this hour, we're going to start our show right now with Dr. Geoff DePaula. We're going to be talking about getting the best care for patients. I'm going to just introduce Dr. Geoff by saying that he comes from a family of doctors and woke up one day and decided that practicing, and correct me if I'm wrong, doctor, that practicing traditional medicine just wasn't cutting it for him and his patients, even more importantly. Would that be accurate?
Well, not exactly, because while it's true that both of my parents are physicians, Western-trained physicians, I actually chose to go another path and became a doctor of acupuncture and traditional Chinese medicine. And happy to say that I'm glad that I did that. So that's how I got interested in or involved in practicing integrative medicine, which is really the best of Western medicine and evidence-based complementary and alternative medicine to get the best care for patients.
Were your parents surprised or upset a little bit when you said, I'm going into an alternative health field?
Philosophically, no. My mother was very supportive. My father was concerned that I'd be able to make a living. so he said, have you thought about medical school? But once the NIH came out and said, oh, acupuncture is good for these things, and the World Health Organization, then he said, oh, NIH says it's okay, then you'll be fine.
Good. And you are.
Sure.
Right? Let's talk about getting the best care for patients. The United States in general is not highly ranked in terms of health care, either quality or expense in the world. Last time I checked, we were in the 30s someplace. Italy was number 1. Why is that?
Well, there's numerous reasons. I think first and foremost, we have a fee-for-service system that rewards hospitals and physicians for doing more procedures, and it benefits the insurance companies, it benefits the pharmaceutical industry, medical device industries, et cetera. So I think that's part of it. That one question right there, that's a week-long answer.
Of course.
But there's many different levels that are involved, and one of them being that integrative medicine services such as acupuncture, chiropractic, naturopathic physicians are typically not covered in most parts of the country. So that's an example of why people aren't getting the best care. And one of the things that integrative medicine does, which is really fundamentally different, and this is really a huge takeaway, is that Western medicine has a very low bar, what they consider healthy. I often will joke with my patients and say, "You're not bleeding out of every orifice. You're fine." Whereas Chinese medicine, for example, has a very high standard for what we consider optimal health. So we're not just treating people once they get sick. We're actually trying to get them well, but also teach them how to stay well, but with a completely different paradigm that far surpasses Western medicine in about 90% of the situation.
I mean, there is a need for traditional or allopathic medicine.
Absolutely.
I mean, car accidents, a seizure, a heart attack, things like that.
Sure. Absolutely.
Right?
It has its place, for sure, absolutely. But for the large majority of patients who are dealing with chronic disease, which drives the overwhelming majority of costs in this country, Western medicine's not doing a great job helping them out. And the side effects of the medications or the treatments are less than desirable. We've all seen the commercials with the long list of side effects that are...
Why would anybody put something in your mouth or inject yourself if there's sudden death, sudden blindness, sudden...
organ failure.
Organ failure, yeah.
Right,
you just drop dead on
the
side.
Well, I think it's because they don't know the alternatives. Really, the reality is that, yes, Western medicine is very good at what it's good at. If you get into a car accident and your bone is sticking out of your leg, you need to go to the ER. You need to get patched up. But then once you do, you need to go to someone like an acupuncturist to help you heal in half the time, to help injuries heal, to help your organs heal. So this is really the fundamental difference is Western medicine treats disease, whereas Chinese medicine treats people's immune system and treats their ability to heal and repair and rejuvenate their body. So we're actually reversing people's biological age, obviously not their chronological age, but we're reversing disease states that have been around for months or years with a combination of Chinese medicine, herbal medicine, acupuncture, lifestyle approaches, sleep, stress reduction, etc. And what most people don't realize is acupuncturists, as a profession, typically are seeing the most difficult cases. People think, you just go for stress reduction, you go for pain. No. Actually, in the clinic, we see people who've been to every specialist. No one can help them, and they either have a unknown diagnosis or a diagnosis that's untreatable from Western medicine perspective, or they don't respond well to the medications. They don't want to take, they don't want to do the treatments that the doctor recommended because of the side effects, and so they seek out a more natural, non-invasive, first do no harm approach. And so that's really what is, what we see in the clinic on a regular basis. So we have to be an expert at everything, but at the same time, we really are an expert at working with the energy system of the body. So
you just said something that really resonates: do no harm. I mean, I think that's amazing. When a doctor prescribes something, and we're going to be talking about the addiction epidemic, and this is not heroin, this is not Oxycontin, this is not marijuana, this is big pharma. We, as the American people, are addicted to pharmaceuticals.
Right.
And
absolutely. And, there was a study that came out from the Journal of American Medical Association back in the 1990s where they did a study and they were trying to figure out what the potential harm was from people taking multiple medications. They're called polypharmacy. So you're taking, 6, 8, 10, 15 medications. And they're all, quote unquote, correctly prescribed, but no one knows what the interaction is because they've never done a double-blind placebo-controlled study for someone taking 15 medications. I mean, who's going to participate in that study? And trying to find the cohort is next to near impossible. So if you're taking more than 2, 3, 4 medications at a time, you're basically a guinea pig. And what they found was in this research article is that correctly prescribed pharmaceutical drugs killed over 110,000 people a year. Back in the 90s, that was twice as many people a year as diabetes. So people don't really hear about that, but it's a huge cause of death. And pharmaceuticals are very powerful, and sometimes they save lives, but oftentimes they're unnecessary and almost always come with side effects.
Would you say that depending on the age of the patient, they're more or less open to an alternative approach such as acupuncture? I'll give an example. My mother-in-law, I convinced her to go to an acupuncturist. She did. She had relief, and her doctor said, "Oh, no, you can't do that." And so she stopped.
Right. Well, what I will say is we see patients from 1 to 90, and most acupuncturists will tell you that their demographic of patients that they mostly see are women, 80% women that are between the age of 30 and 60. They typically have more education than the average person and slightly more income than the average person, but certainly not rich by any stretch. But they're more educated. They want to take a natural approach. Women typically are more open-minded than men in general.
Getting guys to go to the doctor is always a hard thing, too. We're going to take some time out. When we come back, I'd like to continue our discussion and also get into the fact that the paradigm, to use your word, of traditional medicine not only doesn't work, it is frightfully expensive. I can't remember what part of the gross national product of the United States healthcare is, but it's huge, and it doesn't need to be. It could be reduced. I know that that's what President Trump is trying to do. I don't think he's doing it the right way, just slashing, but the point is that we need to do something to contain our costs. You've done some studies on that, and at the same time, you help get you have ideas to get the best care possible for patients. I think that's wonderful. Our guest is Dr. Geoff DePaula. I'm Mark Alyn, here on Late Night Health, along with the insane Daryl Wayne. Join us at latenighthealth.com. Check out our videos at facebook.com/Late Night Health. We'll be back. Don't go away.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate a lower tax bill. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will fight for you using industry secrets that can stop any IRS actions, eliminate penalties and interest, and reduce your past tax bill so you pay the IRS less. If you owe $10,000 or more in back taxes, call the Tax Doctor now for a free IRS audit emergency review.
800-663-5107. 800-663-5107. 800-663-5107. That's 800-663-5107.